Dapagliflozin, sodium glucose cotransporter 2 inhibitor, antidiabetic agent, used to reduce the risk of sustained estimated glomerular filtration rate decline, end-stage kidney disease, cardiovascular death, and hospitalization for heart failure in adults with chronic kidney disease at risk of progression. As an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes mellitus, and for risk reduction of hospitalization for heart failure in adults with type 2 diabetes mellitus and established cardiovascular disease or multiple cardiovascular risk factors. Dapagliflozin causes risk reduction of cardiovascular mortality, hospitalization for heart failure, and urgent heart failure visit in adults with heart failure. Significant side effect: acute kidney injury, bone fractures, hypersensitivity, infection, ketoacidosis, hypotension and volume depletion, lower limb amputation. There are conflicting data involving the risk of lower limb amputation with sodium glucose cotransporter 2 inhibitor. With sodium glucose cotransporter 2 inhibitor therapy, such as canagliflozin was associated with almost a twofold increased risk of lower limb amputations compared to placebo in the CANVAS and the CANVAS-R trials. Trials involving dapagliflozin have not consistently shown an increased risk of lower limb amputation associated with its use. The trials involving dapagliflozin have not consistently shown an increased risk of lower limb amputation associated with its use. Risk factors for lower limb amputation: pre-existing risk factors for amputation, such as prior amputation or peripheral vascular disease or diabetic foot ulcers, age more than 65 years, and lack of preventive foot care.